we have a huge hole in the public finances. We spent £407 billion on COVID support, and our debt now stands at over £2 trillion. And waiting lists will almost certainly go up before they come down. COVID pushed out a great bow wave of cases. People did not or could not seek help. And that wave is now coming back. A tide of anxiety washing into every A&E and every GP. Your hip replacement, your mother's surgery. And this is the priority of the British people. Does anyone seriously imagine that we should not now be raising the funding to sort this out? Is that really the view of responsible Conservatives? I can tell you something. Margaret Thatcher would not have ignored the meteorite that has just crashed through the public finances. She would have wagged her finger and said, more borrowing now is just higher interest rates and even higher taxes later. When this country was sick, our NHS was the nurse. Frontline care workers battled against a new disease selflessly, risking their lives, sacrificing their lives. And it is right that this party that has looked after the NHS for most of its history should be the one to rise to the challenge. 48 new hospitals, 50,000 more nurses, 50 million more GP appointments, 40 new diagnostic centres, and fixing those backlogs with real change. Because the pandemic not only put colossal pressure on the NHS, it was a lightning flash illumination of a problem we have failed to address for decades. In 1948, this country created the National Health Service, but kept social care local. And though that made sense in many ways, generations of older people have found themselves lost in the gap. When COVID broke, there were 100,000 beds in the NHS and 30,000 occupied by people who could have been cared for elsewhere, whether at home or in residential care. And we all know that this problem of delayed discharge is one of the major reasons why it takes too long to get the hospital treatment that your family desperately need. And people worry that they will be the one in 10 to suffer from the potentially catastrophic cost of dementia, wiping out everything they have and preventing them from passing on anything to their families. And we Conservatives stand by those who have shared our values, thrift and hard work, and who face total destitution in this brutal lottery of old age, in which treatment for cancer is funded by the state and care for Alzheimer's is not, or only partly. And to fix these twin problems of the NHS and social care, we aren't just going to siphon billions of new taxes into crucial services without improving performance. We will use new technology so that there is a single set of electronic records as patients pass between health and social care, improving care and ensuring that cash goes to the front line and not on needless bureaucracy.